Yeah, Sonali, you can start now. We are live.
Okay, sir. So, good evening, everyone. I'm Sonali Singh, and today we would be discussing about the topic of ANS, that is autonomic nervous system. So, let's begin. So, before discussing the MCQ part, we need to be very thorough with the classification of drugs because maximum of your MCQs lies in the classification section itself. So first, let us have a look on the classification sections. So beginning with the adrenergic drugs, or also known as sympathomimetics. So these are divided into various class like pressor agents, which would consist of noradrenaline, that is a norepinephrine, epinephrine, ephedrine, dopamine, phenylephrine, methoxamine, and mephenteramine. The next class is of cardiac stimulants, that is adrenaline, isoprenaline, dobutamine. Bronchodilators that would consist of salbutamol, terbutaline, formoterol, etc. Then these also consist of nasal decongestants like oxymetazoline, nafalazolin, phenylephrine. CNS stimulants like amphetamine, dexamphetamine, methamphetamine. Then there is a class called anorextics, that is amphetamine, fenfluramine, dexfenfluramine, sibutramine. And then comes uterine relaxants, that is ritodrin, isoxuprin, salbutamol, terbutaline. So these are sympathomimetic drugs or adrenergic drugs. Let us have a look on the further classification. Further, we have sympatholytics. So sympathomimetics would mimic your sympathetic nervous system, and sympatholytics would block your sympathetic nervous system. So here, if you see, we have all the blocker drugs. So beginning with the alpha adrenergic blocking drugs. So basically, sympathetic nervous system consists of alpha and beta receptors. So drugs acting on the alpha receptors, the classification goes as follows. We have non-equilibrium type and we have equilibrium type, that is a competitive antagonist. So non-equilibrium type have beta haloalkylamine. So the drug is phenoxybenzamine. Then the major class is competitive antagonist, where we have non-selective, alpha-1 selective and alpha-2 selective blockers. So non-selective blockers consist of ergot alkaloids, imidazolin, and miscellaneous drugs. So ergot alkaloids would consist of ergotamine and ergotoxin. Imidazolin is phentolamine, and miscellaneous would consist of chlorpromazine. Also, another class is hydrogenated ergot alkaloids. So these are basically derivatives of ergot alkaloids. So the drugs here are dihydroergotamine, dihydroergotoxin. Alpha-1 selective drugs consist of your zosyn drugs, so prazosin, terazosin, doxazosin, alfuzosin, and tamsulosin. Alpha-2 selective blockers will consist of the drug called yohimbine. Moving further, we have beta adrenergic blocking drugs. So we have two types of beta receptors, beta 1 and beta 2. So these drugs act either selectively or non-selectively. So we have non-selective beta blockers that consist of beta 1 plus beta 2 action. That means these drugs will go and block both beta 1 and beta 2 receptors. So these drugs are propranolol, sotalol, timolol. And these are with intrinsic sympathomimetic activity, without. And pindolol is a drug which has intrinsic sympathomimetic activity. And with alpha blocking property, we have labetalol and carvedilol. So labetalol and carvedilol are two drugs which have both alpha and beta blocking properties. Then we move on to cardioselective beta blockers. So these consist of metoprolol, atenolol, acebutolol, bisoprolol, esmolol, betaxolol, ceriprolol, nebivolol, and many more drugs. So while we solve the MCQs, we will encounter another beta blocker, which is very new. So let's move on with the classification. So we are done with the sympathetic part of the classification, sympathomimetics and sympatholytics. Now we begin with cholinergic drugs classification. So these are basically cholinomimetics. That means they mimic the cholinergic pathway, or also called as parasympathomimetics. So these drugs will mimic your parasympathetic nervous system. So the main drug or the neurotransmitter of the parasympathetic nervous system is acetylcholine. So let us have a look at the classification. So to begin with, we have cholinergic agonist and anticholinesterases. So what basics we need to remember is acetylcholine has a choline part, and it is broken by an enzyme called acetylcholinesterase. So let us look at the drugs. So choline esters and alkaloids are the two classification under cholinergic agonist. Choline esters will consist of acetylcholine, methacholine, carbachol, and bithancol. Alkaloids would consist of muscarine, pilocarpine, and arecolin. Anticholinesterase are further divided into two prominent divisions. They are reversible and irreversible. So first is carbamates. So the carbamates consist of drugs like physostigmine, neostigmine, pyridostigmine, edrophonium, rivastigmine, donepezil, and galantamine. And acridin consists of saccharin. Irreversible drugs again consist of carbamates, which is carbaryl and propixar. These also consist of organophosphates, for example, difluorous, icothiophrate, malathion, parathion, etc. So these are your cholinomimetic drugs. Moving on to anticholinergic drugs. So these are parasympatholytics. Previously, we saw parasympathomimetics that mimics your parasympathetic nervous system. These are parasympatholytics that will block the parasympathetic nervous system, or they are atropine drugs or muscarinic antagonist. So further, they are divided into natural alkaloids, semi-synthetic derivatives, and synthetic compounds. So natural alkaloids consist of atropine, hyoscine, that is also called scopolamine. Semi-synthetic derivatives are atropine, homatropine, hyoscine, ipratropium, tiotropium, etc. Synthetic compounds consist of drugs like antisecretory or antispasmodic, mydriatics, vasicoselective, and anti-Parkinsonism drugs. So antisecretory or antispasmodic drugs consist of quaternary compounds like propantheline, oxyphenonium, clinidium, etc., isopropamide, glycopyrrolate, etc. And other drugs are tertiary amines. So the drugs in this class are dicyclomine, valethamate, and pyrenzapine. Mydriatics are your drugs like cyclopentolate and tropicamide. Vasicoselective are your oxybutynin, flavoxate, tolterodine. And anti-Parkinsonian drugs are trihexyphenidyl, piperidine, etc. So when you talk about autonomic nervous system, so these are not just limited to your sympathetic or parasympathetic nervous system, but there is also a part called autonomic ganglia. So we have drugs which are classified on the basis of their action on the autonomic ganglia as well. So we have ganglionic stimulants and ganglionic blocking drugs. So the stimulants consist of selective nicotinic agonists. So firstly, it is nicotine, lobeline, dimethylphenylpiperazinium, and tetramethylammonium, varenicline. Non-selective muscarinic agonists would consist of acetylcholine, carbachol, pilocarpine, etc. So these were the stimulants. Now we go to blocking agents. So blocking agents consist of competitive blockers, which is further divided into quaternary ammonium compounds, amines, and monosulfonium compounds. And the next classification is of persistent depolarizing blockers. So quaternary ammonium compounds consist of hexamethonium, pentolinium. Amines are mecamylamine and pempidine. And monosulfonium compounds are trimethophan, camphor sulfonate. Whereas persistent depolarizing blockers consist of nicotine in large doses. Nicotine has both the properties of stimulant as well as blocking. So if you can see in stimulant part, if you give small doses of nicotine, it is a stimulant, selective agonist for autonomic ganglia. But when you give the same nicotine in large doses, it has a ganglionic blocking property. And then there is anticholinesterases in large doses. Again, anticholinesterase are also classified in ganglionic stimulants. So it is all about the dose in which you are giving the drug. So if you give it in large dose, it has blocking property. Okay, so with this, we end up with the classification part. Let's move on to the MCQ part. So the first MCQ is, which of the following inhibits the rate limiting step in synthesis of epinephrine? So the answer here is metyrosine. So the reason why metyrosine is the answer is that metyrosine is alpha methyl tyrosine, and it is an analog of tyrosine. So if you see the whole process of synthesis of epinephrine and norepinephrine, tyrosine gets converted to DOPA with the help of tyrosine hydroxylase enzyme. So this metyrosine inhibits tyrosine hydroxylase, and then further it decreases the catecholamine stores. So basically, that is the rate limiting step in the synthesis of epinephrine. Okay. So the second MCQ is, parasympathetic fibers arise from which of the following cranial nerves? So if you remember, the answer here is 3, 7, 9, and 10. So these are the cranial nerves which are involved in parasympathetic fibers arrival. So these nerves are oculomotor, which is the third cranial nerve, facial, that is the seventh cranial nerve, glossopharyngeal, that is the ninth, and vagal is the 10th cranial nerve. Okay, so the next MCQ goes, hemicholinium produces skeletal muscle paralysis by which of the following mechanisms? So by enhancing acetylcholine release, by inhibiting acetylcholine release, by inhibiting the synthesis of acetylcholine, or by inhibiting the reuptake of acetylcholine. So if acetylcholine stays at a particular muscle junction for a long time without it getting reuptake by the various receptors, it can cause a condition like paralysis. So basically, the answer here would be by inhibiting the reuptake of choline. So hemicholinium belongs to acetylcholine antagonist category. It inhibits the reuptake of the choline part and then further producing paralysis. Okay. So the next MCQ is, which of the following drug is both alpha and beta antagonist, but is not beta 1 selective? So if you remember the classification which we discussed, there are two drugs which are prominently called as, which prominently has both alpha and beta blocking properties, and that is your labetalol and carvedilol. So here, if you eliminate the other three, it's labetalol, which is the beta blocker that has both alpha and beta blocking properties and is not beta 1 selective. Moving on to the next one, following our muscarinic antagonist, except. So one of them is a muscarinic antagonist. One of them is not a muscarinic antagonist. It's written except. That means one of them is not antagonist. So the answer here is oxytrymorin. Why? It is a muscarinic agonist and it belongs to the class N-alkyl pyrrolidine. So the other three are belonging to the category of muscarinic antagonists, but this particular drug is the agonist. Hence, this will be the answer here. The next question says, sympathomimetic action and parasympatholytic action on eye differs in A. Reduced aqueous formation, B. Absence of cycloplagia, C. Reduced uveo-scleral outflow, or D. All of the above. So the answer here is absence of cycloplagia. So if you remember your parasympatholytic system, parasympatholytic drugs cause mydriasis, they cause abolition of light reflex, and they cause cycloplagia. So these effects would cause blurred vision to happen. Hence, the answer here is absence of cycloplagia. So sympathomimetics will have this action, but parasympatholytics will have the action of cycloplagia, but sympathomimetics do not. Okay. So non-catecholamine sympathomimetic are. So for this, we need to be very thorough with the chemical structures. So if you remember, the drugs that are involved in your sympathomimetic class, the endogenous drugs like adrenaline, noradrenaline, dopamine, they all have a catecholamine ring. So your isoprenaline, dopamine, dobutamine, or phenylephrine. So let's have a look at the answer. And here it is phenylephrine. Why? Because if you can see here, isoprenaline also has a catecholamine ring. Dopamine also consists of the ring. And dobutamine also consists of the ring. But if you see phenylephrine, it doesn't consist of the catecholamine ring. There is just one OH present here. So the answer here would be phenylephrine. Okay. So tachyphylaxis is an unwanted effect of which of the following drugs? So tachyphylaxis is a condition where your heart rate would increase. So basically, if you see, tachyphylaxis is caused by ephedrine. Why? Because it is an indirect acting sympathomimetic. So its principal mechanism of action is indirect stimulation of adrenergic receptor system by increasing the activity of norepinephrine at the postsynaptic alpha and beta receptors. So the answer here is ephedrine. Okay, so the next is drug that increases uveoscleral outflow is prostaglandin, zolamide, apradonidine, or dipivefrin. So here the answer is prostaglandin. The reason for the same is that prostaglandin and its analogs, they mimic and amplify the effect of naturally occurring tissue response pathway. So basically, They remodel the extracellular matrix of your sclera and enhance the uveoscleral outflow. So that is the reason how they increase the uveoscleral outflow. Moving on to the next one. Which of the following are competitive ganglionic blocking agent except? So now this is a tricky one because we have studied nicotine as both stimulant and as an blocking agent. So the answer here is nicotine, because nicotine has its prominent action on the stimulant part. So nicotine is mostly discussed and it's very prominently acts on the stimulation, works as a stimulant on the ganglionic autonomic ganglia. Whereas if you see the other three drugs, so these drugs are prominently blocking agents. None of them are a part of the stimulant classification. So in this case, it's very clear that it should be nicotine. And if you remember, your anticholinesterase are also having dual action, that is your stimulant as well as your blocking action. So in those cases, if you see the other three options and if you find that all the other three are blocking agents, it's very easy for you to eliminate the other three and choose your MCQ or your answer. So the answer here is nicotine because it's a ganglionic stimulant and others are blocking agents. Okay. Physostigmine is used in the following drug overdose except. So physostigmine has its prominent action and is used as an antidote for drug overdoses. So how it acts is physostigmine enhances the transmission of acetylcholine signals in the brain, and it can cross the blood-brain barrier. It also inhibits acetylcholine esterases. So physostigmine is used to treat anticholinergic poisoning caused by overdoses of atropine, scopolamine, and other anticholinergic drugs. So if you remember the classification, physostigmine and edrophonium both belong to the same class of drug. So edrophonium is also a cholinesterase inhibitor. Hence, the answer here would be edrophonium. That physostigmine cannot be used to treat the drug overdose of edrophonium, whereas it can treat the other three drug overdoses, and it is used as an antidote for the treatment. So I hope I'm clear here. All right. So beta-2 selectivity of adrenergic agonists can be increased by. So for this is a question of your medicinal chemistry. And for this, you need to know your SARs, that is structure-activity relationship of your drugs very well. So if you remember, let us have a look at the options. The option says replacement of catechol by resorcinol, replacement of meta-hydroxy of catechol, replacement of para-hydroxy group of epinephrine, and either A or B. So the answer here is either A or B. So if you replace your catechol by resorcinol or replace the meta-hydroxy of catechol, both would result in the beta-2 selectivity of adrenergic agonist, and it would increase the action. So here you need to know your SARs well, and the structure-activity relationship should be known properly to solve these kind of MCQs. Okay, so moving on to the next MCQ. Which of the following statements is not correct? So these types of questions, we need to look at the options very carefully, read them twice or thrice, and then decide what is the answer. So let us have a look at the options. So first option says alpha receptors increases arterial resistance, whereas beta receptor promotes smooth muscle relaxation. Option B says The skin and splanchnic vessels have predominantly alpha receptors. Option C says vessels in skeletal muscles may constrict or dilate depending on whether alpha or beta receptors are activated. And option D says skeletal muscle vessels have prominently alpha receptors and constrict in the presence of epinephrine and noradrenaline. So, after reading this, you need to know the location of receptors very well. So, if you know that alpha 1 and alpha 2, where are they located, or where are your beta receptors located, you can solve these questions very easily. The answer here is option D. Skeletal muscle vessels have a prominently alpha receptor and constrict in the presence of epinephrine and noradrenaline. So this is a wrong statement. Why? It's not correct because beta 2 receptors are located in the bronchioles of lungs and of the skeletal muscles, not the alpha receptors. Okay, so beta 2 receptors have their location at the skeletal muscle, and all the action would be due to that and not the alpha receptors. So knowing the location of the receptors also becomes very important here. All right. The next MCQ says drug of choice for cardiogenic shock with oligouric renal failure is. So your option says adrenaline, dopamine, ephedrine, and norepinephrine. The answer here, if you have read your literature as well, the answer here is dopamine. It is one of the first line drugs which is used for cardiogenic shock. And if it is associated with oligouric renal failure, then this drug is given very prominently and very often. So sympathomimetic amines with both alpha and beta adrenergic effects are indicated for people with cardiogenic shock. So drugs like dopamine and dobutamine are the drug of choice to improve cardiac contractility, out of which dopamine is preferred agent in patients with hypotension. So if the patient also has hypotension, you may prefer your dopamine. So the answer here is dopamine. I hope this was clear. Okay. Neostigmine is preferred over physostigmine for treating myasthenia gravis because, so let us have a look at the options. Option A says better oral absorptivity. Option B says direct parasympathomimetic action on muscle end plate. Option C says longer duration of action, and option D says cannot penetrate blood-brain barrier. So if you know, the answer here is direct parasympathomimetic action on muscle end plate. So neostigmine has a direct parasympathomimetic action on muscle end plate, and also it is preferred over physostigmine for treating myasthenia gravis. So it was a direct question where you need to know what was the effect and what is the difference of both the drugs, because they belong to the same class. All right. So the next question says, provocative test for autoimmune muscular degeneration is carried out by which of the drugs? Option A says hydrophonium. Option B says neostigmine. Option C says tubocurarine. And option D says atropine. So, if you know, the injection of your tubocurarine is given basically to test autoimmune muscular degeneration. So if you know, hydrophonium is used for treatment of myasthenia gravis, whereas tubocurarine is used for testing whether you have autoimmune muscular degeneration or not. So how it works is that it decreases the grip strength in patients with generalized myasthenia and normal subjects, respectively. So patient with purely ocular myasthenia gravis, they behave as normal subjects. Whereas if you have muscular degeneration, then you will have a decrease of your grip strength. Hence, tubocurarine is used for provocative test of autoimmune muscular degeneration. If you know, tubocurarine is also poisonous. Hence, the doses are not very high. You can see here, and it cannot be used as and when required, but it is only used in specific conditions, and it should not be used on a large scale. All right. So while discussing the classification part, we had discussed that there would be some new drug coming as a beta blocker. So beta blocker that increases HDL level is, so option 1 is labetalol, option B is nadolol, option C is bucindolol, and option D is betaxolol. So the answer here is option C. So bucindolol is a newer beta blocker drug, and when it was studied further, it was found to increase the HDL levels of body. And how it works is it possesses weak alpha adrenergic blocking property and intrinsic sympathomimetic activity. Along with beta blocking property, it also has a weak alpha blocking property. And it is found to increase your HDL levels in your blood. So if you know, beta blockers do have a property of increasing lipids in your blood, but those lipids are not HDL. They mostly decrease the HDL part. But this drug, bucindolol, it will increase your HDL. Other beta blockers had a property of increasing your lipids and triglycerides in the blood, whereas this drug, bucindolol, is very new. So when studied, it further revealed that it increases the HDL levels of your blood. Okay. So propranolol can be used in all of the following conditions except. So the question says except. That means one of the condition here, we cannot use propranolol as a choice of drug. So option 1 is glaucoma, option B is hypertension, C is migraine, and D is pheochromocytoma. So if you know, propranolol belongs to the class of beta blockers, and beta blockers are a widely used class of drugs. So they are used in almost all the possible conditions, right from hypertension to other conditions like congestive heart failure or anginal attack, or be it other conditions like migraine or pheochromocytoma. So the one condition where propranolol is not used is glaucoma. Why? Propranolol is a choice of drug for hypertension, migraine, and pheochromocytoma. It belongs to beta blockers, and beta blockers do have a role in glaucoma. So there are certain beta blockers that are given in glaucoma, but propranolol is not the choice of drug. There are specific beta blockers like betaxolol, there is timolol, and there is levobunolol. These are the first choice of drugs for glaucoma from the beta blocker class. But propranolol is not the choice of drug. It is restricted only till hypertension, migraine, and pheochromocytoma, and not used in glaucoma. So I hope I am clear here. Okay. So M1, that is muscarinic 1 antagonist anti-emetic drug useful in peptic ulcer is. So the option says propanthyline, dicyclomine, glycopyrrolate, or none of the above. So the answer here is glycopyrrolate. It belongs to the class of M1 antagonist, and it is used to treat peptic ulcer in adults. So basically, this is the therapeutic use of glycopyrrolate. It is used for peptic ulcers, being an M1 antagonist. Mostly peptic ulcer drugs are from the class of proton pump inhibitors. or H2 antagonist, as we call them. But this drug, glycopyrrolate, belonging to M1 antagonist, is also used to treat peptic ulcer in adults. Okay, so this is a bit application type of question. An asthma patient was given a non-selective beta agonist to relieve bronchoconstriction. Which of the following adverse effects would be expected? So, there's a patient who has asthma and he was given a non-selective beta agonist to relieve his bronchoconstriction. So if you know, asthma patients are very much allergic, and when their allergy triggers, they have bronchoconstriction, due to which they have breathing issues. So the motive of your treatment or your therapy should be to relax the bronchial muscles. That is, bronchodilation should be the goal of the therapy. So, what are the adverse effects that we would expect if we give a non-selective beta agonist? It is agonist and not antagonist. So be very clear with what it's written. So option A says hypotension. Option B says bradycardia. Option C says tachycardia. Option D says bronchoconstriction gets worsened. So the answer here would be tachycardia. Why? Because agonist of your sympathetic nervous system, like your alpha agonist or beta agonist, would have an effect on your heart rate. That would and the effect would be an increase in your heart rate. So that is known as tachycardia. So adrenergic agonist produces tachycardia by increasing your heart rate. So here, when you give a non-selective beta agonist, it would increase your heart rate. And if you consider other options, they are not true, because, of course, if your heart rate is increasing, you cannot have hypotension or bradycardia. Also, if we are giving the drugs to relieve bronchoconstriction, the bronchoconstriction should not get worsened. And beta agonist would not cause bronchoconstriction. So if you know, we have beta 1 blockers, whereas we don't have beta 2 blockers. The reason is beta 2 receptors are present on your bronchial smooth muscles. And if you give blockers for those receptors, then this condition of bronchoconstriction will occur and the person will choke and die. So hence, these drugs are not in market because they are of no therapeutic use. So we have beta blockers and beta agonists to relieve your asthma or other conditions. All right. So this was for today. So while discussing the MCQs, as I said earlier, majority of your MCQs would be from your classification of drugs part. So if you know your classification well, there shouldn't be any problem in solving those questions because they are one-step answer. You don't have to think about them if you know your classifications well. In terms of application-based question, if you know the functions of your drugs well, then it becomes very easy to solve those MCQs. Also, you should be thorough with your receptor pharmacology as well. So which receptors are part of autonomic nervous system, or for that matter, any system, where are they present, what are their functions, and which drugs are acting as agonist or antagonist for those receptors should be studied, and hence it helps you to solve these kind of MCQs very easily. That's it for the day. If there are any doubts, you can get back. Thank you. So can we close it?